In the grand theater of the human body, where every organ plays its part in a symphony of functions, there exists a cast of characters that often goes unnoticed, yet their influence is profound. These characters are the sympatholytic drugs, or as the medical world likes to call them, adrenergic antagonists. Imagine them as the quiet heroes stepping in to calm the chaos of the sympathetic nervous system, that ever-enthusiastic conductor of the body's stress response. When the world outside is screaming for action, these drugs say, "Hold on a second, let's take a breather." Now, let's delve into how these sympatholytic drugs are classified. Picture a flowchart, a neat little diagram that divides these medications into two main categories: alpha blockers and beta blockers. Alpha blockers, such as prazosin and doxazosin, are like the gentle giants of this narrative. They take on the alpha-1 receptors, those pesky little receptors that, when activated, can lead to constriction of blood vessels and a spike in blood pressure. By blocking these receptors, alpha blockers induce vasodilation, allowing blood to flow freely and easily, lowering blood pressure like a cool breeze on a sweltering day. On the other side of the stage, we have the beta blockers, with stars like propranolol and atenolol shining brightly in their roles. These medications are the multitaskers of the group. They primarily target the beta-1 receptors in the heart, reducing heart rate and contractility, almost like a conductor slowing down the tempo of a frantic orchestra. But wait, there's more. Some beta blockers also venture into the realm of beta-2 receptors, affecting smooth muscles in the bronchi and blood vessels, adding another layer of complexity to their performance. Now, let's explore the mechanism of action, the behind-the-scenes magic that makes the show possible. When sympatholytic drugs enter the stage, they block adrenergic receptors like seasoned actors stepping into their roles. Alpha blockers, with their knack for blocking those alpha-1 receptors, lead to a beautiful act of vasodilation and reduced blood pressure. Meanwhile, beta blockers, with their dual focus, slow down the heart and ease the tension in the vascular system. It's a delicate dance, a choreography of inhibition that allows the body to find its balance amid the chaos. But what's a show without a purpose? The therapeutic uses of sympatholytic drugs are vast and varied, each condition a different scene in this medical drama. Hypertension, that silent but dangerous villain, is met with the steadfast resolve of alpha blockers, who step in to lower blood pressure and restore calm. Heart conditions, like arrhythmias and heart failure, find solace in the embrace of beta blockers, who regulate the heart's rhythm and protect it from undue stress. Even anxiety, that unwelcome guest that can crash the party, is managed with the help of beta blockers, easing the physical symptoms that can accompany those racing thoughts. And let's not forget about benign prostatic hyperplasia, or BPH, where alpha blockers come to the rescue, improving urinary flow and allowing for a more comfortable existence. But, as with any great performance, there are moments of conflict and tension. The adverse effects of sympatholytic drugs are the plot twists that keep the audience on their toes. For alpha blockers, there's the risk of orthostatic hypotension, a dizzying drop in blood pressure that can leave one feeling lightheaded. Dizziness and fatigue may also join the cast, reminding us that even heroes have their struggles. On the beta blocker side, bradycardia can slow the heart too much, leaving one feeling sluggish, and for asthmatic patients, there's the potential for bronchospasm, a reminder that not every action is without consequence. As we draw the curtains on this exploration of sympatholytic drugs, let's reflect on the key takeaways. These medications play a crucial role in managing a variety of medical conditions, acting as the calm in the storm of the sympathetic nervous system. They remind us that sometimes it's okay to take a step back, to slow down, and to breathe. But as with any medication, it's essential to consult with a healthcare provider to ensure that the right choice is made for individual needs. So here we are, at the end of our journey, having witnessed the fascinating interplay of science and medicine. Just like a well-crafted narrative, the story of sympatholytic drugs is one of balance, control, and the delicate art of managing life's many challenges. In a world that often pushes us to the edge, these drugs offer a gentle reminder that sometimes the best way to move forward is to pause and take a breath. And in that breath, we find the strength to face whatever comes next.